Hi everyone. Today I'm going to talk about ankylosing spondylitis. I'm going to go through the signs and symptoms and the cause of this injury, and by the end of this video I'm going to show you a couple of exercises that you can do at home that can improve your pain and mobility. To maximize your results, I would suggest you to follow this routine daily basis at least once for at least a period of 2 to 3 weeks. Let's get started. Before I start this routine, I would like to thank you for your support and all the questions that you ask me through this channel. The purpose of this channel is to help you to understand what can you do about your condition or injury and start your routine with some simple exercises at home and slowly build up and improve your pain and mobility. Please make sure to ask me any question you have underneath of the videos that I have in this channel, and I will definitely get back to you. If you've never been in this channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercises that you can do them at home without any equipment and slowly build up and improve your symptoms and your injury. Make sure to subscribe, like and share this video with your friends and family. Ankylosing spondylitis is a type of arthritis which is cause progressive pain and swelling in the spine and the sacroiliac joint, the joint that connects our spine to the hip bone. Other joints can be affected as well in this condition, which is a systemic disease, which means it may affect other body parts and organs in our body. This condition tends to run in families in some cases. It affects not only the joint but also the joint capsule and the ligaments. The pain and stiffness will progress to fusion of the spine and the sacroiliac joint. Ankylosing spondylitis, in clinical practice, is also called bamboo spine. It is more common in men versus women. Almost men 3 times more than women, and typically the age range for this condition is between 20 years old to 40 years old. The exact cause of ankylosing spondylitis is not clear. Researchers believe that people with certain genes are prone to develop ankylosing spondylitis when they are exposed to a virus, bacteria, or another triggers. Many people with ankylosing spondylitis have a gene called HLA-B27, but most people that have the gene might never develop ankylosing spondylitis. Study believes only 1 in every 20 people who carry these genes develop ankylosing spondylitis. The signs and symptoms of ankylosing spondylitis are back pain and stiffness, and specifically at night during the rest. This pain and stiffness improves with movement and exercise. Uveitis or eye infection is another sign of ankylosing spondylitis. Hip pain due to the SI joint involvement, shortness of breath, which is in severe cases fusion of sternocostal joint. X-ray, MRI scan and blood tests are simple diagnostic tool for this condition. And in X-ray or MRI scan, patients are commonly will see with the bamboo spine. And when they do the blood test, they were looking at those specific genes such as HLA-B27. There are some other basically genes that they could be possibly exist in people with ankylosing spondylitis that we mentioned here. For treatment of this condition, physical therapy and rehabilitation exercises are the most common treatment, which is keep the patient staying active and help them to maintain their mobility and minimize their pain. In severe cases, anti-inflammatory tablets like NSAIDs are common for using to improve the pain and inflammation. As I explained to you earlier, ankylosing spondylitis can affect your pelvis and your SI joint as well as your spine. Now, the first exercise that we're going to do, we're going to improve the hip mobility with a simple exercise that we call hip tilt. I'm going to show you the exercise from different angle and you can give it a try. You're going to need to have a pillow just for your own comfort. You're going to lie on your back, and what we're trying to do, we're trying to posteriorly tilt our pelvis, which means if you use your hands underneath of your lower back, the area that you feel the curve, you can actually feel your pressure of your body when you pressing your abdominal down. We want to hold there that exercise for 5 seconds. 4, 3, 2, and relax. And initially you might not have that much coordination, but as soon as you try to do this exercise regularly, you can get more actually mobility there. We're gonna hold it there for another 5 seconds. 4, 3, 2, and relax. I'm gonna show you from the different angle. Literally what we're trying to do, we're trying to hold your hands underneath of your back and push your basically lower back down to the ground. While you're doing this, your hip is on the ground and you feel that pressure basically down on your hand. I'm gonna show you without my hands. I'm gonna push it down, hold it there for 5 seconds. 4, 3, 2, and relax. You're going to follow this exercise for 3 sets of 5 to 8 and hold it for 5 seconds, and slowly you can increase your range of movements and mobility. We're going to move on to the second exercise, that it's basically baby pose. Now, in this exercise, we're going to progress eventually from a seated position. You got to be in this position. If you don't feel comfortable, I brought this pillow. You can actually adjust that underneath of your toes, because that can give you a little bit of kind of like comfort to be able to sit on your foot. For some people that can be difficult. Now I'm going to show you what we're going to do. We're going to try to go to the baby pose or child pose position, and from here we want to come to a cobra, which means you don't want to go for a full range. You're going to go slowly down, stay there, breathe in and breathe out. Now, how far you're gonna go here, it's all depends on your mobility, which means if you don't feel to go all the way down, which means on your hip, don't push it and slowly build up that, which means we're trying to create some sort of like stretch and movement and mobility on the hip and the lower back. And when you're coming up, even up to here, that's fine. You can go back if you feel more comfortable to even stay on this position. We'll try to just keep that movement within that range, which means don't push it. And if you find this exercise is difficult, there's another version that I'm going to show you that you can give it a try, which means you're going to go to basically prone position and you want to come slowly up, hold it there for a few seconds and back down. If you feel more comfortable, you can come a little bit higher. 5, 4, 3, 2, and relax. Now, if you are doing this all the way to the push-up position, make sure that your hip are not coming off the ground. You want to keep them on the ground and slowly back. You don't want to come too high. You're going to come back up, hold it there for 5 seconds. 4, 3, 2, and relax. Now, you want to try this routine for 3 sets of 5 to 8 again. Work around your own range, don't push it, and slowly build up mobility. We're going to progress this routine to a very gentle and simple movement stretch, which is a passive stretch that you're going to lie on your back. And we're trying to literally get comfortable there, and you're trying to drop your knees to the side. You don't want to go all the way down. You want to go to the point that it feels comfortable. You can get a great stretch around your lower back, and at the same time it actually give you a bit of, you might even get a crack on your lower back, and at the same time you can get a good stretch on your hip. You want to hold it there for 10 seconds. You can try the same thing in the other side. Breathe in and out. See, you might feel comfortable to go all the way down, or you want to go halfway through. That's totally fine, but let the gravity actually does the job, which means don't push it. Hold it there for 10 seconds, and you can try the same thing in the other side. You can try this exercise again, 3 sets of 8 to 10, play around with it, breathe in and out, try to stay relaxed, and we're gonna move on to the next exercise. The next move that I'm going to show you guys is literally gonna be a strengthening exercise for your hip, which is a simple routine that you can try, but I'm gonna show you 2 different versions that you can challenge yourself as well. We call it hip bridge or glute bridges. You're gonna lie on your back, feet shoulder apart, hands on the ground, and we're trying to hold this basically position for 5 seconds, and you're going to come slow down. You want to push through your whole foot and squeeze the glutes at the top. Hold them there for 5 seconds. You might not go all the way up, go to the point that you feel comfortable, but at the same time you're engaging the muscle. Try to challenge yourself. You want to try it there for holding it between 3 to 5 seconds initially. Slow down. You want to go all the way up, slow control. You don't want to bring it all the way down and bang it. You want to go slow and controlled up to here and back up again. Now, if you felt comfortable to do these, what you could do a single leg bridges, partial, which means we'll try to do, let's say, 3 reps in one side, and you don't hold for this exercise. You change legs. It's a very good exercise to challenge your hip and your glute strength. All the way up, slow control down. You can try that for 3 sets of, let's say, 2 to 3 rounds each side, and slowly build up and challenge yourself. I'm going to progress your exercise to a next routine, which is a mobility exercise that actually challenge your lower back and your hip movement. We call it cat camel, and you're going to be on your hand's going to be under your shoulder, your knee's going to be under your hip, and we're trying to get that pelvic tilt progress, which means you're going to try to get more movement through your hip and your lower back. You want to stretch it, hold it there for 4 seconds, and then you want to relax. Make sure it's not about actually holding the stretch, it's more about getting that movement through your whole lower back and upper back and your hip. Bring it down. Try to breathe in and out. As you can see, I'm fully arching my back and trying to stay relaxed. I'm not trying to tense it. All the way up again. And slow control down. I'm going to show you one more round. Up. And slow down. You're trying to basically get movement rather than holding the stretch. Try it for 3 sets of 5 to 8. Take your time. Be patient, and you will see huge different mobility in your lower back. The last exercise that I'm going to show you guys today is going to be a routine that I'm going to challenge you basically. And one of the things that you see in ankylosing spondylitis, your back becomes very stiff. Unfortunately, doing stretches alone is not going to necessarily help you to strengthen your upper back muscle. This exercise, it's a very simple routine, but you will see a challenge. You're going to lie on your back, and it's specifically designed for you to strengthen your back. You don't need any weight, but you can use your own body weight. You're going to use your elbows to apply pressure and lift your body. Hold it there for 3 seconds. Slow down. Back up again. You're basically opening up your chest. 2, and relax. Up. 4, 3, 1. Up again. 3, 2, and relax. If you can hold it longer, even better. 3, 2, 1. Literally, what we're trying to do, we're trying to push our body in that position. We're going to open up your chest and hold your elbows as the point that actually applying pressure. Now, this exercise can help you to strengthen your mid-back muscle group, which means your rhomboids, and slightly your upper rhomboids, which is a necessary muscle group that can help you to improve your posture, specifically for ankylosing spondylitis. I hope you guys find this routine helpful. If you're experiencing ankylosing spondylitis, this routine can help you to improve your pain and your mobility. Make sure to follow the routine at least once a day for a minimum period of 3 weeks time. If you have any question, make sure to leave me a comment underneath of this video and I'll get back to you. Don't forget to subscribe, like and share this video with your friends and your family. Until next week, all the best.